We are back, and Deputy Premier and Health Minister Steve Kent joins us now on line, 2? Are you there, sir?
I am indeed, Pete.
Thank you very much for taking the time today.
No problem.
So an awful lot of discussion, a lot of people wondering, I guess, what is going on with the time frame. Some say it's awful hasty and rash to try to squeeze it in. They reference, of course, the move to reduce the number of districts from 48 to 40 in such a short period of time as well. What's going on? Why are we doing things in such a hurry all of a sudden?
Well, we've been working on this for months, Pete. I should say that, first of all. We have a huge demand for long-term care beds in Newfoundland and Labrador, and what we announced back in April was a commitment to build 360 new publicly funded long-term care beds, and they'll be provided through partnership with the private or non-profit sectors. And so we've laid out a clear plan. It's an innovative approach. It's one that's been used across the country, and basically we're going to end up having more publicly funded long-term care provided by the private or non-profit sectors. As for the timeline, we know it's ambitious, but with the demands that we face for long-term care, we have to expand the availability of facilities to meet the needs of our residents, and we've got to move quickly. But that said, through the consultation we've done with industry and through the work we've done with Partnerships BC, which is a crown corporation of the BC government who has a lot of experience in this area, while the timeline is aggressive and it's ambitious, it is reasonable and it is realistic, and everybody involved feels that the timelines can be met. But we can't afford to sit and wait. We've been criticized for not moving fast enough when it comes to meeting long-term care needs in the province, despite the fact that we've made a lot of progress over the last number of years.
Well, that's what I was just going to say. I mean, that's what people are saying, that you have been sitting and waiting, and now all of a sudden, well after the need was there and it's been coming and growing, all of a sudden now, with an extended election time, you're trying to squeeze it in before the deadline.
Well, we've built several new facilities and opened up hundreds of beds during our time in office. But despite that progress, our population is aging. Our population is aging faster than the population of the rest of the country.
But that's no surprise. We've known that. We've seen that. We've understood the demographics for some time. There's no magic here, right?
And that's why we've built new facilities, and that's why we need to build more. And in fact, beyond these beds, we'll have to build more in the next number of years. This is not the end. There will be more needed as well.
Had things not taken the route they have with the second go-around, with the leadership, with the Bill 42 coming in, leading to this new legislation that's going to reduce it to 40, and the election pushed off to the end of November, you wouldn't have been able to do this. Or are you taking advantage of an extended deadline past the legislated date that came in some years ago?
No, that's nonsense. We have a responsibility to govern, and we have a responsibility to provide these health services to our residents, and we've got to come up with the most efficient and effective way to do so without compromising care in any way. And we should never have to pay more for services. If we can be certain and guarantee the same high quality for a lower cost, then we need to do so, and that's our goal. We're not going to sign off on any project that compromises on quality of care or costs.
Well, that's what we want to talk about next. But just before we get there, let me ask you, isn't this the exact sort of thing, even though you weren't around in provincial politics back at that time, this is exactly what Danny Williams at the time was condemning Roger Grimes for, saying you are an unelected premier, you should not be doing anything of significance. If there is something that you feel that needs to be done in a certain time frame, then you go to the people and get a mandate. Go earlier rather than later. Don't try to do it under these circumstances when there's so much to be risked, I suppose, for a long-term project or severe expenditures from the public purse.
Pete, private and nonprofit providers already play a prominent role in providing care to our elderly in this province. We've got home support agencies, we've got personal care homes, all of which are private. These facilities that we're going to construct now will provide high-quality long-term care. They'll be governed by the same operational standards as existing facilities in our province, and there will be policies and processes in place to ensure that people receive the same care as they do in publicly run facilities. So while this is a shift, I would argue it's it's not a major shift, and in fact, this is happening in every province in Canada, including Newfoundland and Labrador.
I'm talking about doing things of significance, long-term plans and expenditures and changes like reducing the number of seats in a time frame at the end of an extended mandate where people will really wonder if you've got the public confidence to do so.
So you're arguing within the last year of a government's mandate we should...
I'm saying exactly what Danny Williams said during the waning months of the Roger Grimes administration. He said you should never do things like this.
Well, I disagree. We have a mandate to govern. We're fulfilling that mandate. We also have a responsibility to meet the health care needs of our residents, and that's exactly what we're doing through this announcement. And at the end of the day, I think we're going to be better off, and we'll have 360 new beds. We'll create hundreds of new jobs, and we'll provide high-quality care to people that are currently tying up beds in our acute care facilities. We have surgeries being canceled. We have people lying on stretchers in hallways. We have people sitting in emergency rooms for too long. We've got to address those issues, Pete, whether there's an election this year or next year or whenever it is.
There was a forum recently down at the Lantern. Diana Gibson from the Canadian Centre for Policy Alternatives was here. She says there is significant, irrefutable evidence through valid studies that say seniors fare way worse in such institutions and actually die earlier in these kinds of P3 institutions. How do you respond to that?
That's not what our research tells us. We know that there are unions in the country and in our own province that are going to be very critical of this. The opposition is criticizing us but providing no valid alternative.
Well, they say the profit margin required in a privately run institution and the fact that it costs more for them to borrow the money and invariably will lead to cutting corners and less care.
But there's lots of controls in place to ensure that that doesn't happen. And all we've got to do is look to other provinces to know that private and nonprofit providers do play a key role in providing high-quality care at a lower cost than the public sector. So by expanding the presence of these providers, I think it creates a tremendous opportunity to provide high-quality care in a manner that's more sustainable financially. And whether the facility is private or nonprofit or public, that won't have any impact on the resident's experience. The process for assessing individuals is the same. The financial implications for clients don't change. When a bed becomes available in the facility of the person's choice, they'll be offered that bed. None of that changes, and at the end of the day, we would never do anything that would compromise the quality of care.
Will the employees be required to have the same qualifications?
Absolutely.
They'll
absolutely require the same qualifications, and the number of care hours will be the same. All of those standards are clearly spelled out.
But they're going to be able to get workers with the same qualifications at lower salaries.
Well,
benefits.
that's not what our experience in even our own local market tells us. We have one private long-term care facility in Chancellor Park. The retention of employees at that facility has been quite solid. It is a unionized facility, so what we're talking about here is creating new jobs, not replacing existing ones, and they'll quite likely be unionized jobs. We've worked closely with Partnerships BC on this, as you know, and they've told us from their experience the private providers find efficiencies in a number of ways, and they ensure optimal utilization of staff. They strategically plan shifts to maximize efficiency. They look at food service delivery models that minimize food wastage. The buildings tend to be constructed in a more home-like, less institutional manner at a lower cost. And because the private providers own the facilities, they're very well aware of the need to manage their risk and provide quality care in the most efficient way possible. But it's definitely not about cutting corners. In fact, the standards that are in place in our public facilities must be maintained in the private facilities as well.
And they say a very important part of it is that it can work is if there is considerable transparency, adequate transparency, and reviews regular for accountability.
For sure, and there will be regular monitoring. In fact, I suspect in the private facilities there will end up being even more monitoring in some ways than what we see in our public facilities. And there will be an infinite amount of transparency. These facilities will be constructed and owned and operated privately, but they'll be seamlessly integrated into the existing long-term care system. And the quality of care, as I've said, won't change, nor will the funding. These are publicly funded long-term care beds, and I think it's important to make that clear as well.
Whether it's real or not, there is the appearance that there has been some difficulty in the transfer with youth homes. Can you guarantee or suggest that there is reasons to assume that this will not be the case with these particular homes?
Well, what we're doing here is already well understood. The private and nonprofit providers, there are private and nonprofit providers who already play a prominent role in providing care, and private providers that deliver care for individuals through home support agencies and personal care homes already exist and do a good job in our province. So we plan to enter into care agreements that will provide long-term care services from a private provider. We'll pay for that service. We'll make sure in order to increase availability and access. And it's similar to the arrangement that already exists with Chancellor Park, and it's not a lot different than what exists with our personal care homes in the province, and there's 90 of those. Okay,
I got to switch just for a second at the very tail end of this, but you're taking some flack from some of your tone, I suppose, or specific wording with some Twitter action here. How do you respond to the criticism that it's rolling up here right now?
Yes, Pete. Well, you're a regular Twitter user, and sometimes the Twitter crowd can be a sensitive bunch. The funny thing is, people are allowed to harass and abuse and make some pretty provocative statements towards politicians. But any time that a public figure responds, you end up getting further attacked. So I have no problem defending my actions and defending my comments, and I also won't apologize for responding to some of the nonsense that we have to endure on Twitter.
All right, Steve Kent, I do appreciate your time today, sir. We'll be talking again. Anytime you have anything to bring to us, we'll be more than happy to have you back on.
Well, I appreciate it, Pete. And again, we won't be signing off on anything that compromises quality of care. We're gonna do the right thing for the residents that we need to serve.
I'm writing it down.
Thank you very much.
We'll talk to you again.
All right, take care.
Bye-bye.
Bye.